Great. Welcome everyone to this beautiful spring day as we start our briefing here on April 28th. Hard to believe it's the end of April already, and 2 weeks have gone by, but here we are. We are at 41,404 confirmed cases as of today. I am very sorry to report more deaths, and again, I can't wait for that day where I don't have to report any more deaths. But since we have last spoken, we've had 8 more deaths, and now at 564, and that was a +4 on this Sunday. Just tragic to see still here as we reach almost 70% vaccinated that we're still having deaths in this community related to COVID. The good news is we do only have 12 people in ICU now from COVID, and that number does fluctuate a little bit. So we hope to see that go down and stay down rather than fluctuating like it has. But the good news is we do have a lot of ICU beds available, and we hope to never use them. County testing, we remain second in the state at 869 tests per 100,000. We are still promoting testing, though we are down 4.7% from last week. We just did almost 4,600 individuals receive tests last week. We still have our testing site open on campus here for our employees. But it is important that we keep testing for the variety of reasons that we've told you in the past. And those are that we need to confirm where the cases are so that we can do our contact tracing and make sure that people stay safe, that we understand what variants are out there in our community. And of course, these numbers count towards our adjusted case rate. So the current county run test sites and hours can be found at www.smcgov.org/testing. I can tell you, we have got tons of testing out there right now. Blueprint for a safer economy, the county metrics as of Tuesday, April 27th. We are not going to be moving to the yellow tier. In fact, our adjusted case rate has gone up slightly from 2.0 to 2.5. And that is obviously regarding 100 per 100,000 on a 7-day lag. But that is unfortunate as we were on the cusp before, but it just goes to show you how this virus acts, and you were down and up and now back up slightly, which will not allow us to move to yellow for at least a few weeks if we move under the 2.0 adjusted case rate and stay there for 2 weeks. So that would put us mid-May. And who knows, the governor seems to be indicating that the tier system may go away, and certainly expect it to go away if we have enough vaccine out for 16 and above and the hospitalizations are down. But that will go away on June 15th. I don't know if we'll get to yellow before that. I can only hope that we do, but we will keep you posted on that. According to the CDC, California's coronavirus rate is now the lowest in the continental U.S. And that's something to certainly be celebrated, as we have only 33 per 100,000, dramatically lower than the nationwide rate of 116.4 per 100,000. So you can still see the prevalence and where the locations are that is out there. As I indicated, moving beyond the blueprint, we look forward to June 15th when things will open up and the tier system will hopefully go away. As you all know, the CDC yesterday eased the mask, the face mask guidelines for the fully vaccinated folks out there, as long as you're outdoors. As you may have heard, the CDC issued new recommendations that fully vaccinated people no longer need to wear a mask outdoors except in certain crowded settings and venues. The CDC has updated recommendations for masking, and the county will continue to follow the guidance from the California Department of Public Health, which plans to follow the CDC. So the CDPH will follow the CDC, and we will follow the California Department of Public Health. So we are not going to do anything different. We are certainly waiting for the specifics about that from the state, but looks like they will be following the CDC's guidelines, and we will be following them. Vaccination update. The great news is the vaccination doses coming to the county have improved dramatically, and we do have a lot of doses in the county right now. The supply has certainly increased, especially with HRISA vaccine coming directly to SMMC from the Fed. So that is all good news there. And we've got enough vaccination this week to do 2 mass vax, one today and one tomorrow. And then next week, we will continue to do mass vaccinations. Janssen vaccine can be used again after review by the CDC Advisory Committee. So that is available. Pfizer vaccine has been submitted to the FDA for approval for use of 12 to 15, and that is likely to be approved in the future. So we had an allocation of 14,390 total doses via Blue Shield, plus 9,970 doses from HRISA. So you can see that we're now in the 24,000 range. This is more than we've ever had before. And that's why we're opening up and feel that any resident who wants a dose can find a dose in this county right now. And we're encouraging everyone to stick their arm out and get vaccinated so that we can stop the spread that we've seen just recently with a slight uptick in cases, and we can open up to society sooner and with the confidence that people are vaccinated. So and we're just about at 70% here. In fact, I'm going to call it 70% because these numbers were yesterday, and Sarija would probably support me on this, that we're probably at 70% after yesterday. But the California Registry data as of 4/26 showed 445,776 individuals vaccinated with over 707,000 doses, which it comes out to 69.4 of our total eligibility. I know we did more yesterday, so that number has probably gone up, and we're over 70%, which is great. We have a long ways to go, though. We can say that and see that we have reached here 56.4% of eligible adults, and our lowest HPI index census tracts. So you can see the difference between as a 69% overall and the 56% that we have in the lowest HPI. But the good news is that that difference hasn't changed much as we're moving up. Our vaccinations have reached 54.2% people of color, 38.6% white, and 7.2% of unknown. And we can see from the data dashboard that 115,000 residents 65 and older have been vaccinated so far, which is 88.5%, which is terrific news. And of this group, of the 55,000 SMC residents 75 and older, we have vaccinated over 90%. So the mass vax effort, we're encouraging everyone to sign up on My Turn. That is the mechanism now to be notified where you can get the vaccine. We have the mass vax going today and tomorrow at the event center, and we'll have more next week. Along with that, so we're not only going to do the mass vax, we're going to stay in our communities, our low HPI areas, and we're going to continue those community vaccination programs. And we're going to try to do everything that we can to reach everybody, encourage everybody in those neighborhoods to get vaccinated. We are currently going door to door in some of these areas with our community affairs folks and volunteers and city folks, just to make sure that we reach everybody and let them know that we have vaccine. And if you're so inclined, and we hope you are, this is the time to get it. For the NFO clinic, beginning Sunday, that clinic will be run in partnership with Dignity Health, Sequoia Healthcare District, and the City of Redwood City. And this is a welcome change. It frees up some of our resources to go elsewhere. But Dignity has taken this on in large part, and with Sequoia Healthcare District, we can't thank them enough. They've always been great partners with us. And all these partners will be taking over a part of the operational responsibility on that site, which will really help bolster availability and provide operational sustainability, so that we just wanted to show some appreciation toward Dignity, Sequoia Healthcare District, and Redwood City for really helping us out here. A little bit about the Emergency Rental Assistance Program. The state has begun to release some data on this and submission rate of applications for the Emergency Rental Assistance Program. So based on preliminary data shared by the state, as of April 24th, San Mateo County has active cases of 1,295, total fund requests of 16,691,000. Total funds approved 1.2 million right now, and total funds paid 87,000. This is a fund that we have 50 million in, so we hope everyone avails themselves of that opportunity who is in need and unable to pay their rent. The funding is there. The CBOs are there to help with the applications, and we encourage everybody to apply that is in need. Okay, we've also, why don't we show that flyer? We've also updated the flyer for the rental assistance program. And so tenants and landlords can go here and really get information. Great, thanks. Let's see, so onto the Great Plates, over 2.2 million meals served to date, 4,500 participants, 84 active restaurants, and that will go through May 7th. Typically May 6th or so, we'll hear if it's continued or not. But we will finish out the month either way, with the county supplementing the rest of the month if necessary. So on to some of your questions that were pre-submitted. What's the county's response to CC loosening mask wearing? And I think we went over this. We will certainly align with the state on this. We're just waiting for more specifics coming from the state. But we are not going to have an individual mask recommendation here. We will be following the state of California, which so far has indicated it will follow the CDC. Sarija, anything else on that?
No, you covered it, Mike.
Okay. How confident are you that the county will be moved into the Yellow tier next week, despite having a fluctuating adjustment case rate? I can tell you we'll not move into the Yellow tier next week or probably anytime soon. And it's just unfortunate. We've tried very diligently to get below that, but the case rate, as you indicated, whoever asked the question, is fluctuating, and we're not able to move. If we do, it'd be more probably closely likely to June, or maybe we'll never get there. And in June 15th, the tier system will go away. So we'll see what happens here. It's hard to say. More people get vaccinated, the better, and the closer we'll probably get to that. Seeing the progress the county is making with vaccinations, how are officials preparing to address vaccine hesitancy to reach its goal of vaccinating at least 90% of the residents? That goal is something that we still firmly believe that we can reach, and we are trying everything that we can. We are using trusted members of the community. We are out there literally going door to door. We have different strategies for reaching those that are homebound. And we are really focusing on those communities that are most vulnerable, and we'll continue to focus on them in partnership with the cities, in partnership with the CBOs. We're using volunteers, but we're going to stay there as long as it takes, and we'll keep reevaluating our success there and employing new ideas and new concepts to get people out to get vaccinated. Sarija, more on that?
Yeah, I just want to add that, we recognize that it will likely take as much time to get to those who we have not yet reached even though it's a much smaller number of residents than those who've already been reached. You know, we have a group of residents who are extremely ready and eager to be vaccinated, and as supply allowed, and we've partnered with so many to make the reach possible. Folks were waiting to just know, where can I go? Where can I go? How can I get the vaccine? Some of our residents have much less flexibility with work schedules, caregiving responsibilities, transportation barriers. And we just know that we need to be able to provide predictable, easy to access, easy to plan for pathways. And we haven't been in a position to do that until really this week, when we've had enough vaccine supply and a glimmer that there will be enough next week and the following week to be able to offer more advanced information, working with deeply trusted partners, knowing, you know, helping meet people where they are, so that when folks are ready and when we have the opportunity to engage with people, and whether that's a public health person or someone's doctor or their medical team or the local pharmacy or a trusted neighbor from a church community, we need to give this some time and persistence and continued investment in those locally targeted, culturally tailored approaches to meet people where they are and have vaccine pathways available in whatever way is necessary.
Thanks, Sarita. I think you hit on an important part there, and that's really the stability of not only the doses, but the locations where people can know they can just go. And, you know, we have an abundance now of pharmacies in this county where people can go to and get vaccinated. And we hope, and maybe this goes to the next point about vaccine hesitancy in the county at this point. We don't know what that is yet. But maybe some people are just waiting for some of the lines to die down, or maybe just getting information now about the availability of it. We hope that's the case. But right now is the time to get it. We have availability at the event center the next several days. We will do it again next week and have availability. There's availability at pharmacies. I mean, you can go to a variety of different locations, and we will be active, continue to be active in the communities. And for a lot of those communities, you know, some of those sites are becoming more and more stable and known. So we're hoping that people avail themselves of that opportunity as we, you know, use a variety of means and go later in the night and open these and keep them open on weekends, so people can just pop in without an appointment and get taken care of. So we'll continue to monitor that, and we will utilize every means possible to make sure that we reach our goal. And we're usually pretty good at reaching our goals. So I have no doubt that we'll get there. Okay, Mitzi, questions?
Yes, we do have several hands raised. Why don't we start with Henrietta?
Henrietta.
Hello. Some states are suffering from an oversupply of vaccines, and the county was suffering from a lack of vaccines. So I'm wondering how things are now. Are there areas in the county that have an oversupply and some areas with an undersupply? How are things evening out, or are they?
Well, Henrietta, I think you're right. I think that, you know, we heard from, you know, Blue Shield that they were getting some doses back from other supplies and redistributing them. And I think that's been going on for a while now. But I can tell you that doses here in the county are not oversupplied and undersupplied in any one area. That there's availability now throughout the county that people should avail themselves of. And I would venture to say that it is in every community in this county and easily accessible at this point. Within a day or two, if you go to one of these sites, or if you're signed up on My Turn. So we do have it throughout the county. We do have what we believe, at least this week and next week, are sufficient supplies. And we think things will get better after that also, as some of these other doses are redistributed to California and certainly to the Bay Area.
I have one more question. Talking about the family rental assistance, is there a limit to the amount of money a family or individual can get under the rental assistance program?
That's a good question. I don't think so. But we have an abundance of money available. You know, they've looked at the applications right now and they're around 16 million. And we've got about 50 million available to this county.
For the landlords, but not
Yeah, so I believe that not the tenant, thank you, Connie, who's updating me as we speak. So not the tenant, but the landlord, there's a limited amount that the landlord can request. And obviously the landlord has to take a reduction in that rent. I believe it's 20%, but not the tenant. Through that certain period of time, what's available. So we are encouraging tenants. This is a great way to get out from under that debt. We are encouraging them to sign up for this. And we have an abundance of money right now.
And it doesn't have to be repaid to the county.
Does not. Nope. That's the beauty of it.
Thank you.
Okay.
Why don't we go to Sarah?
Sarah, good to hear from you.
Hi, Mike. Thanks. Are you guys currently running a community site anywhere in Pacifica? And if not, why not? Or do you have plans to?
I don't think we do, but in Pacifica, we had several on the coast, and I think in Half Moon Bay, and we're trying to do central locations where we're seeing the need and the lower HPI areas. So we do have one in Daly City and South San Francisco, but we do have one on the coast. Sarita, do you remember where on the coast?
I don't have this week's schedule right in front of me. We could certainly get back to you. And we do look at the data of the vaccination rate in each city and each community and each census tract to target where we stand up a locally targeted effort versus areas in which it looks like the available pathways, whether it's local pharmacies, our other major healthcare partners, the Kaiser South San Francisco Clinic, for example. And about a week ago, I believe, when I looked at Pacifica, there was relatively high reach, higher than the county average. That might have changed a little bit, and we were seeing a lot of available pathways. But we look at this every single week to plan for the next week as to where there are gaps.
Thank you.
Okay, next.
Astrid.
Astrid, how are you?
Hi, I'm good. Hi, Mike and Srija. About the.
Oh, Astrid, we can barely hear you.
Oh, can you hear me now?
A little bit better, but not much.
Okay. Okay, I'll just try to shout. Can you hear me? Okay.
Now we can hear you.
Okay. Do you expect that the vaccination rates in the lowest HPI communities will at some point meet the countywide average?
Boy, that's our hope. I mean, we'd love to see that. Whether that'll be a reality or not remains to be seen. But yeah, we'd love to get there. Sarita, what are your thoughts?
Yeah, our goal is zero gap, and we're continuing to persist in learning what is necessary to remove the barriers that are contributing to the gap right now. So we're going to keep learning and figuring out. We do expect it to take longer to reach the same level of penetration in our lowest resource communities. There are just more burdens to overcome for many of the residents in terms of schedules and flexibility. And we also are humble about the distrust that has to be overcome and earned, working to learn what that's going to take.
Thank you. One more question. Any update on the number of breakthrough cases that the county has had?
Sarita?
I don't have a number. We do track these and report them to the California Department of Public Health, and the state has been reporting the number, which is part of what the CDC is tracking. I could get back to you on what the state's number is, which is on the CDPH website.
Okay, thank you so much.
Thanks, Astrid.
Are there any plans to reopen a mass vaccination clinic at the San Francisco International Airport in the near future?
Yeah, I mean, we think that we want to keep it centralized so people know where it's at. We do know that there are dates in June where the county fair will be in operation, and our plan is to move the mass vax to South San Francisco at that time. But we feel that given the amount of doses that we can handle whether it's 7 days a week or longer hours, whatever it might be, that we can handle the masses through the event center.
And that's all the questions we have at this time.
All right, no more questions. Listen, everybody, thank you so much for being here. We really appreciate it. And we look forward to seeing you in 2 weeks. Stay safe. Bye-bye.